Hi everybody, my name is Denise. I work for Berks Plastic Surgery. I'm an esthetician in the Fleetwood Lords and Ladies. I have been involved in aesthetics for 30 plus years. I love what I do. I love to talk about it. So today I'm going to talk about Melanoma Awareness Month. So over 5 million cases are diagnosed each year in the United States. It's the most common and the most preventable of cancers. I want to touch base on UVA and UVB since I don't know everybody completely understands the difference between them. I do word association, so for me, I do UVA. I think of those as A is the aging rays. So those are the ones that are going to be the deepest penetrating to the skin. So they're going to destroy the dermis, they're going to destroy the collagen of the skin. They're really two big support factors to your skin. Also, they will penetrate through clouds, they will penetrate through glass. So we always say just because it's a rainy day or it's a cloudy day, don't think that you're not getting those damaging rays to the skin. You know, you just have to make it your sunscreens a daily routine in with your morning routine. And sunscreens have come such a long way that most of them are tinted. A lot of people use them as a foundation. So there's no real reason why you shouldn't have them on your skin. UVB are the burning rays. So they are the ones that, sorry about that glare. They're the ones that are going to burn the skin. B, burning. They're going to attack the superficial layers of the skin. They also have the highest intensity between 10 a.m. and 4 p.m. That's why sometimes they'll say if you're going to be outside, go out early morning or go out late afternoon because you won't have those UVB rays that are going to burn the skin. They will not penetrate the clouds and they don't penetrate glass. So that's the difference between UVA and UVB. So I'm going to talk about the most common skin cancers. It's your basal cell, your melanoma, and your squamous cell carcinoma. Basal cell is 80% of skin cancer diagnosed is basal cell. So it is the most common. A lot of people have been diagnosed with it or know people that have, or the damage is very minimal. And if it's caught early, it's treated, and there's really no real problems with that. Usually appears as those white waxy bumps on the skin. Sometimes it can have a white, brown scaly patch as well. All of these generally will appear in areas where you have been exposed to the sun or have had burns to the sun. I mean, sometimes it's people. My mother had a squamous cell, and hers was because she got burned from her curling iron, like years and years and years and years and years. That it just developed, and it never healed itself. And I will say about the squamous cell, they are the slowest of growing skin cancers. So the next is the melanoma. This one occurs, okay, when the pigment-producing cells that give color to the skin become cancerous. Usually it shows as a growth or a change in an existing mole. So sometimes, we all have moles on our skin, and all of a sudden one could start to change, look a little different, shape-wise, maybe it's raised. Those are signs of something going on. Again, if it is treated early, it's curable, not going to be a problem. If not treated early, it will spread deeper into the skin. And into different parts of the body. So this is when it does become more difficult to treat, and it can be deadly. Squamous cell. This is one that is a flat, reddish brown, scaly, crusty surface. Sometimes these can bleed. Again, like I stated earlier, usually these are slow growing. I know my mom's, the slang for it was a rat cancer. It was like a slow eating cancer. Again, if detected, it can be cured, it can be treated. If not, this is aggressive and it will spread and there could be serious complications to it. Again, it's always good to self-check, do your yearly body checks, and anything that looks suspicious, just have it checked. It can't hurt, because sometimes it's not these obvious things I just explained or described. It can be something that you're looking at and thinking, oh, there's nothing wrong with that. That's not raised, it's not crusty. It doesn't always have to look like that. So please, just because I gave those descriptions, please don't think that, oh, okay, well then that, you know, this does look a little weird, but doesn't sound like anything she described. Some other factors besides your UV exposures that can be causes for skin cancer are skin tone. So in aesthetics, when somebody comes into our room and say they want to do chemical peels, they want to do something a little more aggressive to the skin, we look at their skin and give them a Fitzpatrick rating to know how we're going to treat their skin, how aggressive we can treat their skin. So Fitzpatricks go from 1 to 6. 1 is obviously the fairest of skins. So those are very pale. They're usually redheads, freckles. 2, now obviously Fitzpatrick 1 will burn. They don't tan. So really they shouldn't be in the sun for any reason of trying to get a suntan. It's not going to happen. They're just going to damage their skin. Fitzpatrick 2 sometimes, generally they will burn. Not like Fitzpatrick 1. And they'll tan a little bit, but nothing too crazy. Fitzpatrick 3, sometimes they'll burn, but they will get a tan, a nice tan. 4 burns minimally and will have that nice golden tan. And 5 and 6 rarely burn because these are the dark pigmented individuals. So you're Indian, Middle Eastern, African American. So you'll never see a burn on their skin. They will darken, but they won't burn like the other Fitzpatricks will. So with that being said, Caucasians are 20 times more likely to be diagnosed with skin cancer than African Americans. It doesn't mean that African Americans or that Fitzpatrick 5, 6 can't get skin cancer. Obviously they can, it's just that it's later detected because it's not as obvious. So it can be, when their diagnosis does happen, sometimes it can be at a very progressed stage. So it can be a little bit more deadly for those Fitzpatricks when it is diagnosed. The other factors are age and sex. So until the age of 49, women are a greater risk of developing melanoma. After 50, men are more likely to be diagnosed with melanoma. Also, women that have been diagnosed with HPVs, they're also at a higher risk for melanoma. So with all this being said, it's, we stress, in our business how important sunscreens are, and they truly are, and they have come a long way. They're not that white goopy stuff or the stuff in your nose is white. You can use them as makeup. So I always stress to my ladies, and I mean, most of them are very good with it. Some of them fight me on it, but obviously nobody wants to go through any of these diagnoses and have them be advanced. This brings me to the next topic, sunscreens and SPFs. So SPF tells you how much UVB, which remember is your burning rays, a sunscreen can filter out. Now, there's always a question, how often should I apply? The things that I have read, and they're saying the easiest for people to do is every 2 hours reapply. I know, your sunscreens go from 4 to 50. you know, it can be you're sweating, you're swimming, you're, you know, toweling yourself off because you're sweating. So just the easiest thing, the safest thing to say is just be conscious of the time that you're out, and hey, it's 2 hours, I bet I should reapply. You know, it's the most preventable way of burning your skin. Most studies show that SPF 30 is going to filter out 97% of those UVB rays. So there's so many different SPFs strength-wise. So if you're just looking to do it the easiest way, 30 is going to be plenty for your skin. Again, reapply every 2 hours. Please remember that number does not mean you can stay in the sun longer without reapplying. So that's why, again, every 2 hours. Remember the ears. Everybody, when you know you're doing, you're making sure you get everything protected, and you forget that if you are swimming or you have your hair pulled back, that the ears, you know, will burn, and sometimes that's a place where cancer will, you know, be hiding, and it's not as easily detected or noticeable as something that's on the body that you're seeing visually. So always make sure you have the ears protected and the bottoms or tops of the feet. I mean, I know I've done this, and it's not pleasant. So always make sure that you put that sunscreen tops of your feet. Some of my favorites that I like are the Avène Tinted Compact. They come in 2 shades, I think beige and honey. And those are tinted moisturizers. It has your antioxidants to it. I love it. I use it as my makeup. Now, I do change it from the warmer weather to the colder weather because I do have combination skin. So for me, that compact is a little bit heavier for me in the summer, so then I'll go to just a lighter one. So that's kind of a personal preference. Revision is another one, which is IntelliShade. Some are matte for oily skin. They don't come in different tints. That's just a universal tint. SkinCeuticals, Physical Fusion. One is a normal and one is a tinted. And Skin Medica, Total Defense and Repair. Again, that one is normal and one is tinted. So the only one I think that really has the shades is the Avène. The others, again, they do give you a coverage, so it is nice if you're going to be running out errands or you're going to be going to the grocery store and you don't want to worry about putting makeup on. Those tints are nice because it gives you a nice coverage to your skin. All of those can be purchased, or you can check those out on Lords and Ladies website. Also, if you don't have a dermatologist, or you know you feel like you should have your body exam done, your body check, you can, we have Berks Plastic Surgery has a derm PA on site. I believe it's Stacey. Forgive me if it's not. Yeah, Stacey. So you can, and that information will be on the page, or so that if you need to get in touch with Stacey or you want to make that appointment, please do so. She's great. You'll love her. So I hope I gave you some good information today. If you have any questions, please reach out. I do have a Facebook page, Advanced Skincare by Denise. Also, Instagram is Aesthetics is Love. So if you aren't following me, please follow me. I love to talk about it. I love to post products, treatments, I give recipes, talk about food. So some people will send me pictures, you know, hey, this is going on with my skin. What would you recommend? So I'd love to hear from everybody about, you know, any problems, any questions. So please feel free to reach out to me on those websites. So I think that is about it for today. So hopefully you walked away with some good stuff. Please stay safe, take care, and hopefully we will see you soon. Bye.